Hi, second year students, Michelle here. We're going to be going over today how to change a sterile dressing over a central line. And it's quite a process. You're going to have to really hone up on your sterile technique about putting sterile gloves on and how to manage a sterile field. So let's get started. All right, to get started on our central line dressing change, we need to go get all of our supplies. We're going to need clean gloves. We're going to need a sterile, or what they call a PIC or CVC dressing change kit. Too high. I'm going to bring some extra tape in with me. If I have an immunocompromised patient, I'm going to want to bring in a biopatch, which is the little disc that surrounds the exit of the catheter and to help prevent infection. I'm going to need an alcohol pad in case the adhesive isn't wanting to release for me. That's useful for that. And I'm going to bring in an extra pair of sterile gloves. Always good to have an extra pair handy. So this is all the stuff I'm going to need in order to perform this procedure. In order to begin our procedure, our first step is to go in and talk to Tom and explain to him what we're going to be doing with his central line. Hi, Tom. It's Michelle again. Can you state your name and date of birth for me, please?
Tom Jones, 5/11/59.
Great. So as I mentioned to you earlier, it's time for us to change the dressing over your central line access. It says here on the label that the last nurse changed its initials was MD, and that sort of quote, it was changed 7 days ago. For a sidebar here for nursing students, you would see actual dates on your label, and you're going to need to be checking those to make sure when those dressing change due dates are. So Tom, what I'm going to do is remove this dressing, clean the area around where this little ivy goes in, and then put a new dressing on top. While I'm doing that, I'm going to need to have you turn your head away from your right side. So you're going to turn over to the left so that you won't breathe on that site when I have the dressing off. So that's our process. So you just get to relax, and I will take care of that dressing. So I'm going to go get my supplies, and I'll be right back. So we're ready to get our supplies set out to do this dressing change. This is pretty classic of a patient's room. This is our only workspace. They've left to us as nurses, and it's kind of busy right now. So we need to get an area that we can work on and maintain sterility. So we're going to remove all of these patient supplies. We're going to give a little clean up to our area. I'm going to go wash my hands. And thus the reason that we like to use chucks in our patients' rooms, so that it just helps give us a little more cleanliness when we're trying to do a sterile procedure. Remember, chucks have plastic backing to them and help to prevent wicking of material from the tabletop itself. So we needed to have our StatLock PIC and CVC dressing change kit ready to go. So we're going to get this open, and we'll see what's inside. So the first thing I need is the mask. I need to be masked, so not only does Tom need to have his head turned, but I need to be masked so that I'm not breathing directly on this wound exit for this. So I'm going to go over here, keep my arms out of my sterile field, and that doesn't need to be sterile. They also put a little pair of gloves in here, and we also need to maintain sterile field and grab those and get those out of there. So I'm going to don my mask, and I'm going to have clean gloves, and our first step is that we're going to need to remove the old dressing. All right, we're ready to start with the dressing change, and Dana's going to be reading through the steps, and we'd like you to use the same process in the lab when you're practicing. Okay, Dana, what's my first step?
Okay, so you've applied your non-sterile exam gloves. Now you're going to remove the old dressing. Remember, all areas under an occlusive dressing are considered sterile. However, if dressing was not maintained occlusive, then nothing is sterile underneath it.
When you're going to remove a semi-transparent dressing, if you kind of roll the corner up and then you pull horizontally, and it causes the dressing to release. and it's much less painful for the patient because it lets go of the skin. So I'm just going to work all the way around the edges towards the center.
Careful that your hands aren't covering it.
Now this dressing has tape where the lumens come out of the catheter. And that's an area that can cause your dressing to become non-occlusive. And so you may see extra tape in this area in order to keep that dressing down. Stat locks are great, but they do make it a little more challenging when trying to maintain the occlusiveness of your dressing. Dana, what is the name of that tape that can be used?
It's called Hipafix. It's sort of a cottony tape. It has a cotton feel to it. Less irritating to the skin.
And I know in our kit, it's almost like a little adhesive strip that's almost got a foam-like. So I just do the same thing, stretching over that stat lock too to keep this releasing. All right, the dressing's released.
So now what we want to do is we want to remove the old stat lock and biopatch if it is present.
All right.
Make sure the weight of the catheter will not dislodge from the insertion site. Consider using tape to secure external length of catheter from pulling on insertion side.
So this one, as I'm noticing, doesn't seem to have a suture up here holding it in. So that could be a problem. So they're recommending that perhaps I just put a piece of tape across the ends of this lumens. And let's do that, because the last thing I want is for that central line to come falling out of my patient.
Many of them are sutured, so you always want to check. If they're sutured in place, it'll make your life a little easier.
So I just put a little wrap around my 3 lumens here and taped it down. Now I'm feeling a little more secure that this isn't going to come out. Okay, so I've got that released.
And you notice how she unclipped. There's little clips to the stat lock, so she opened up on each side and pulled it off the clips.
So I've got an alcohol pad. It says remove with alcohol. And if you saturate the stat lock adhesive, it helps it to remove.
And your kit does come with alcohol swabs.
They're sterile in there. We might not be able to get to them, so I would have an extra
That's true.
set of alcohol.
So you want to have your
in
extra set of alcohol.
Pocket, just in
Absolutely
case.
true. Actually, I think the ones in the kit are used to clean around the side if it's scabby
Oh, if it's
or
crusty,
yeah,
yeah.
crusty. Yeah.
All right, so we're going to get the stat lock off of here.
So your hand.
I got one side to release. It's a little easier with human skin.
Yeah,
'cause it's
mannequins.
softer. There we
Mannequins
go.
harder to get off.
Yeah, so just take your time and you'll get there. Got my glove. I'm going to add a little more alcohol right to this dressing.
So while she's doing this, I know her hand is covering the area quite a bit, but she has to get it off, so we'll let her do that. And the catheter is moving, as you can see, but the reason it's moving is because this is a mannequin, and it would move in a person, but with our mannequin, they're not very secure. It's a bigger hole than the lumen.
Most of the time you see these sutured in place and they're not going to be quite so, especially stat locks. All right, we got our stat lock off.
So now what she's going to do is she's going to apply her sterile gloves and organize supplies on sterile field in order of use.
So we're ready to set up our sterile field, which means the first thing we have to do is don our sterile gloves. You have to watch this packaging in these little procedure kits, because it can foul you up. So be very careful and make sure that the paper's good. All right, so I'm going to start with my right hand, and remember I have to go red to red. Remember last year's video. So I need to get a hold of the cuff, which is the inside. Find all my little finger holes. I know there's a thumb there somewhere. He's way up there, but I got him. All right, one is on. Now this time, this hand is green. Remember, it's sterile. Right now, this whole thing is sterile. I'm going to get my fingers under the cuff. Once my fingers are in there, remember I have to hitchhike, get that thumb out of the way, and slide your hand in. Be careful not to touch anything with your cuff. All right, I have sterile hands. So, paper sterile in the center. I can throw it out of my way. In the kit, I'm going to have a sterile field in which to set my supplies on. So I'm going to lift it in, out of the bin, shake it out. Find my other corner. Still sterile, I haven't touched the table yet, but once I drop it, now we have that 1-inch border all the way around that is considered a non-sterile area. So in my kit, I can lay things out. So I have my alcohol swabs, I have it, and remember, see, only my sterile hands are over my sterile field. I'm not reaching across it. These are those little adhesive strips that if I need them. They also supply you with sterile gauze. And the sterile gauze is if you have a newly implanted central line. Sometimes they're a little weepy, and you may need to put a little piece of gauze in there in order to get the fluid that is leaking out and collect that. So we're not going to need these. This dressing's been in for a while. So I'm just going to drop them off to the side. I have a dressing change label, which I'm going to not need to maintain sterile because I'm going to put that on at the very end. So I'm just going to drop it off to the side for later. I have my ChloraPrep scrub. I'm going to need that, and it needs to be sterile, so I drop it on my field. There's a measuring tape in here, especially for PICC lines, because they're not totally inserted like a central line is. There can be some coiled and taped down to the skin. So an IV nurse would use this in order to measure it and establish that the PICC line it has not migrated out. So that's what that's for. We're not going to have to measure, so I can pitch it off to the side. I also have then my new Stat Lock kit with all the little pieces and parts. So I can put these on my sterile field. This is a skin prep, and this is my new Stat Lock. And I have, oh, there's another prep pad. Benzoin. Benzoin is the sticky. Benzoin, if I have a patient who sort of has very oily skin or is real sweaty, after you've used the skin prep to sort of clean the skin, sometimes you have to use the benzoin and it causes it to become stickier so that your dressing will actually adhere to their skin. So that's
not used a lot.
No, it's sort of an extra backup item just in case. It's very smelly. The smell of benzoin, we'll have to make sure you guys get a chance to smell that in lab. If you have a patient who has any respiratory compromise, that may be difficult for them to tolerate. There's another adhesive strip. Oh, and Stat Lock advertisement, always important to have advertisement for the company. The other thing in my kit then is the occlusive dressing, the semi-transparent occlusive dressing that's going to go on then at the end. So all my supplies here are inside my 1-inch boundary of my sterile field. So we're looking good, Dana.
Okay. All right, so you're going to take your alcohol swab and clean around the insertion site when crusting or soiling is present. So she's going to look at that insertion site and see, and most of the time you do need to use them, clean it around the insertion site.
Okay, so let's go back to our patient.
Okay, so Michelle now is going to clean with alcohol. And she'll tell you how to clean properly with the alcohol.
So when I want to use my alcohol swab, I'm going to start at the insertion site, go around, and bigger, and bigger, and bigger. You're always dragging bacteria away from the wound. Alcohol kills with friction. Chlorhexidine, as you're going to see in a minute, kills very differently. So depending on how crusty your site is, that's really what the alcohol is for. If this was perfectly clean, we wouldn't need to use the alcohol. But there's normally a little bit of crusting from the fluids that have leaked from around. So around, bigger, bigger, bigger. So you're always dragging bacteria out and away from the insertion site. All right,
Okay.
Dana, that's done.
Now we're going to probably just take a second and let it dry a little bit. And then we're going to follow with ChlorPrep sponge. You're going to squeeze the applicator, if you want to show them.
So I'm going to show you.
Yeah.
This is the actual applicator. I'll turn it over here so you can read it.
And you're going to squeeze the applicator grips to activate solution into the swab.
You heard it click.
Using some pressure, but being careful not to dislodge catheter, wipe back and forth and up and down several times over an area at least the size of the sterile dressing, and remove all evidence of dried drainage soiling. Allow it to dry.
The one thing about ChlorPrep is patients can be allergic to this, so you do want to ask your patients if they have an allergy to chlorhexidine. If they don't, this is a very interesting antibacterial. It kills by penetrating down through several layers of the epidermis. It is pretty amazing. So it kills by contact. Where alcohol, we're trying to drag bacteria away, the ChlorPreps are put on in an actual scrubbing motion. So we're going to start scrubbing back and forth in a sort of a grid pattern all around where this is going to be.
And how long do they do that, Michelle?
We need to scrub for 30 seconds.
Total.
All around the area. I'm going to move over here. I don't know if you noticed, Dana, but I touched those lumens with my left hand. So now I'm kind of not going to be able to use that as a sterile hand as much. So my right hand's still sterile. This one I had to hold, and I am going to have to kind of stabilize those. That the reason I hung on to it is I didn't want my central line
She'll
to
have to
pull
do that
out.
anyway because we don't want it to fall out.
All right.
So now we're gonna let this dry, and on a mannequin it will not dry. And we don't do that.
Wave.
We don't ever wave.
We don't blow.
We don't blow. But
just have to
anyway,
let it
we
dry.
will say that it's dry because the mannequin is plastic. So
In the meantime, I can use one of my little sterile guys just to. I have to dry my mannequin, or I won't get my dressing to
right.
stick.
But in real life, on a person, you'll just let it dry, and it will dry in a few seconds. So now what Michelle's going to do, she's going to she's going to open the skin protectant swab and carefully apply over area to be covered by dressing and or stat lock. And remember to do not go directly over insertion site.
It burns. So this is the skin protectant pad, and I would open this, and using the pad, get it out of there with my little right sterile hand here. Oh, come on out, little pad.
Of course, this is how it is in real life. You know,
Yeah.
things get stuck in packages and
got
we
it.
have to fool with it.
Got it. So I would put this all around on my mannequin where my dressing is going to be going. And as I'm trying to get my...
We're going to let that dry, and we'll say it's dry. Now we're going to apply our stat lock or biopatch at this time.
All right, my patient is not immunocompromised. And you know, Dana, this is going to be really a problem not having a sterile left hand because I need to handle this entire dressing. So, good thing I brought those sterile gloves in. New sterile gloves, ready to go. So it's time to put the stat lock on. So I'm going to remove the backing. I know, I got to get a hold of it. Here we go, now you can see it. So I got to remove this backing. And I'm going to leave a little place for me to hang on. Sticky loves gloves. So it's a little tricky, but you got to get under here and move that stat lock up into place. So it needs to be snug and up close to the exit. So I'm going to tap that down and then capture. Hopefully my hands aren't in the way. I need to capture.
Good.
And then I can finish pulling that paper off there. The little wings go over and they click into place. All right, our catheter is now secure once again.
Now if they were going to put a biopatch on, where would that go, Michelle?
It goes underneath and around the catheter insertion site.
Good, okay. All right, so now we are going to apply the dressing so the transparent window exposes insertion site near the center. Mold the slit on the dressing around the catheter or hub in a manner that creates occlusive securement to protect insertion site from outside air and moisture. Use additional woven tape, the HIPAFIX, as needed to accomplish occlusive environment.
So the Tegaderm size that they've put in the kit is a pretty nice size. There's a lot to cover there. So we want to get this and so that the insertion site is close to center as possible, but also being aware of the 3 lumens coming off of this and how those little pigtails want to lift your dressing. If it lifts it up, it's no longer occlusive. So we're going to have to really think about where we want to place this dressing. So I peeled the back off. And it's given me a nice window here, and I'm going to be looking down to see about where I want that dressing to be. So the insertion site is almost in the dead center. I give it a little stretch and then working from the center, get that dressing down on the skin. All right, at this point now my site is covered.
And this basically is the end of the sterile part of it, because now that you've got the occlusive dressing on, sterilization is not necessary.
So we're just going to remove the outside cover and making sure that that dressing continues to stay stuck underneath. We don't want it to lift. On the end of this, this dressing, they do have a little date strip, and we used those last year when we were doing the dressings for the IVs that you learned how to do. So you have that, but in your kit, they also have another one that you can use. This one's sort of bulky. I don't know which one I'm going to prefer.
I usually use the other one.
Yeah, it's a little less bulky for the patient. Mm-hmm. All right, so here's the little trouble spot right here. This I had on here just to make sure they weren't going to get away from me. The patient's going to have different IV lines attached to this, and you can see here that there's a chance for lifting and pulling that dressing up. So what we want to do is secure this area. In our kit, they gave us these little foam adhesives as one choice.
And you can use that as well as the HIPAFIX, whatever works.
Yeah, so we could try these as a way of trying to secure this edge down. So that's one thing you can do. 3M makes a product called transport tape. I don't know if you can see that.
Just a second. Well, let me just lower. Let me get it in the camera. There you are.
There we go. I like this tape, and it is also helpful for maintaining. And what I do, if you make a little tear, slide this underneath here, and you let that tear come up and around. So you've surrounded your lumens from that side, and you're holding that edge down, and you do the same thing on the top. Another piece of tape, make just a little bit of a tear in it. And now this one goes on the top of the lumens. And
Was the first tape
around.
sticking up? Was the sticky part sticking up?
No, it's down to the skin.
Oh, it's down.
Yeah,
Okay.
so it's
Good.
both of them are down, and so that helps here. They can have a little tension on here, and it doesn't lift your entire dressing up, and then helps it to maintain the occlusiveness of it.
Okay, that's
All
great.
right, so we need to label, and we will be done.
So she's going to label it with her initials and the date it was changed.
And we're going to tell you that it's August the
4th.
4th.
Today's August the 4th. That's the day we're doing this.
Yeah. So we can put this date label on here, and then 7 days from now, so the 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, so 8, 11, 11, it would be due to change after 7 days.
And now she's going to document the central line site assessment and dressing activity in the EMR. And we're good to go.
That looks like a sharp dressing, Dana.
Sharp dressing, Michelle.
Thanks.
Excellent.